Hello, good evening from Cambodia, everyone. And thank you very much, Dr. Martin, for your kind introductions and for the opportunity to present our experience on what it takes from the landscape analysis to pilot project on multiple micronutrient supplementation for pregnant women in Cambodia. So the overall goal of the landscape analysis was to assess the enabling environment to support a transition from iron folic acid to maternal multiple micronutrient supplementation. And the study has three specific objectives. First, to review the current evidence on nutritional status, national policy and program and monitoring system. Second was to map out the context of readiness for implementing maternal MMS interventions as part of ANC services in the country. And finally, to make recommendations about how to best make investment in order to effectively introduce and scale up maternal MMS in Cambodia. Basically, the exercise consisted of four methods, including a depth review of Cambodia's specific scientific and program literature on nutritional status, micronutrient supplementation during pregnancy, the functionality of ANC platform, and the existing national policy and maternal nutrition. Then the semi-structured interview for the stakeholder analysis were conducted to identify perspective on maternal MMS with four different group of stakeholders, including the government, donor, UN agency, and civil society organization. The consultative meeting with the government stakeholder and local manufacturer were conducted to gather information related to MMS supply readiness for both immediate and long-term consideration. Finally, the workshop was conducted to build a consensus among the key stakeholders in order to discuss and agree on the next step and way forward. You know, Cambodia is experiencing a shift from high level of undernutrition, especially stunting decreasing from 32% in 2014 to 22% in 2022, toward increasing overweight and obesity. But multiple micronutrient deficiency remain a serious concern in the country. Anemia among women of reproductive age is high at 53%. However, the iron deficiency is low at 3% due to the genetic hemoglobin disorder and thalassemia issue. Multiple micronutrient deficiency are high among women of reproductive age. For instance, zinc deficiency is at 63%, while vitamin D deficiency is at 31%. 38% of the mother with iron deficiency and folate deficiency among women is about 18%. Low birth weight incident based on the maternal recall is range from 8 to 12% in Cambodia. So maternal nutrition is supported through IFA supplementation and counseling, which is delivered through ANC service at the health facility. Based on the result from the national survey, attendance at ANC is high, with 95% of the women attending at least one visit. 76% of women attend 4 or more ANC visits in Cambodia, and 94% of women reported that they receive at least 90 days of IFA supplement during the last pregnancy. However, 76% of women reported that they adhere to the 90 recommended dose of IFA supplementation. It is important to note that the rate of ANC attendance vary significantly by the province, with more remote provinces achieving only about 75% coverage for the ANC. So the landscape analysis found that in overall, there is a strong and broad support from the stakeholder to transition from IFA to MMS during pregnancy. And this is really important and helpful for the success of this initiative. During our consensus building workshop, Cambodia stakeholders agreed to shift from IFA to MMS, starting with the pilot project guided by the National Steering Committee, chaired by the Secretary of State for Health, with different stakeholders as a member, including the representative from the government, donor, UN agency, and civil society organization. Based on the plan, we are going to start our pilot project next month for a period of 24 months. Overall objective of this pilot project is to assess the multi-level factor that influence optimal MMS among pregnant women in Cambodia. It is a mixed method study involved with something like peer count, quantitative survey, focus group discussion, community participatory workshop, semi-structured interview, in-depth interview, market observations, and costing analysis. There are 4 aims, as you can see, including the acceptability study for 2 weeks, formative assessment of optimal maternal health facilitator and barrier for 3 months, social marketing assessment for 3 months, IFA versus MMS adherence study for 6 months. So my presentation is ending. I would like to acknowledge Ministry of Health, Vitamin D, Vitamin Angel, and Curve Humanitarian Foundation for the great support. Thank you very much for your attention.